You know, in the fight against superbugs, some antibiotics are like your frontline soldiers, right? But others are the elite specialists. They're the ones you call in for the most critical, high-stakes missions. Today, we're profiling one of these special agents, Daptomycin.
So let me ask you this. What actually happens when our best antibiotics just stop working? It's a scary thought, and it's a question that honestly keeps a lot of doctors up at night. When you're facing a dangerous infection that's resistant to all your frontline defenses, you need a totally different kind of weapon. It's time to call in a specialist. And that right there is where our story begins.
All right, so let's meet our specialist. Daptomycin isn't your everyday run-of-the-mill antibiotic. No, this is a precision weapon. It's engineered to take down a very, very specific set of targets. And just look at this target profile. It's got laser focus. Daptomycin has an incredibly narrow but super powerful spectrum. It completely ignores all the gram-negative bacteria out there to concentrate all its firepower on these notorious gram-positive threats. And yeah, we're talking about the big ones, the superbugs you hear about, like MRSA and VRE. These are some of the absolute toughest infections to treat.
So how does it take these superbugs down so darn effectively? Well, its method it's really unlike almost any other antibiotic out there. It's this rapid, direct assault on the bacterial cell itself.
This breakdown of its four-step attack is just brilliant. First, it needs calcium ions to lock onto the bacterial cell membrane. It's like a key. Then, it literally inserts itself into the membrane and gangs up with other daptomycin molecules to form a channel. This channel punches a hole, triggering this catastrophic leak that causes the whole cell to just collapse. All its essential life support systems, making DNA, RNA, proteins, they all just shut down. And the result? A swift and decisive kill.
Okay, so here's our specialist spec sheet. We've got that gram-positive only target spectrum, and it's delivered straight into the bloodstream, IV only. Now, its effectiveness is measured by something called the AUC over MIC. Let's make that simple. It just means the higher the concentration of the drug we can get in the body compared to the bare minimum needed to stop the bug, the better it works. So more drug equals more power.
All right, so with this incredibly powerful weapon in our arsenal, what are its approved missions? Let's take a look at the official deployment rules, because you don't just use this for anything.
Daptomycin is absolutely reserved for the most serious situations. We're talking about really complicated skin infections, the kind often caused by MRSA. We're talking about bacteria in the bloodstream, specifically from Staph aureus, and even infections on the right side of the heart, which is a condition called infective endocarditis. These are not just infections, these are life-threatening emergencies.
And this right here is a critical point. Daptomycin is a reserve agent. It's one of our last lines of defense. We have to protect how well it works by only deploying it when our main agents, like vancomycin or linezolid, have either failed or can't be used. This is really the heart of what we call antimicrobial stewardship, preserving our most powerful tools so they actually still work when we need them the most.
Now, every specialist has a weakness, right? A situation where they should never, ever be deployed. And for daptomycin, this isn't just a suggestion. It's an absolute, ironclad rule.
Let me be as clear as I can possibly be. You never, ever use daptomycin to treat pneumonia. It is completely useless for any kind of lung infection, and here's exactly why.
See, our lungs are coated in this substance called surfactant, and you can just think of surfactant as daptomycin's kryptonite. It literally binds to the drug and completely inactivates it, just like that. The drug never even gets a chance to reach the bacteria. So using it for pneumonia isn't just a bad idea, it's a guaranteed treatment failure.
Okay, beyond that one major vulnerability, we also need to watch out for a key side effect, muscle toxicity or myopathy. We keep an eye on this by checking a muscle enzyme called CPK every week. But, and this is a big but, if your patient is also taking a statin for their cholesterol, the risk of muscle damage goes way up. That's why the standard recommendation is usually to just pause the statin while the patient is on daptomycin.
This brings us to the really practical side of things. Safely preparing and administering this drug is every bit as critical as choosing to use it in the first place. You've got to follow some pretty strict protocols here.
And here is another one of those non-negotiable rules, the diluent. Daptomycin can only be mixed with normal saline. If you try to use dextrose, it'll cause the drug to precipitate. It'll literally form solid particles in the solution, making it completely unsafe to administer. A simple mistake with huge consequences.
So, let's make it easy. Here's a simple pre-flight checklist for any clinician out there. 1. Check the patient's kidney function. 2. Confirm if they're on a statin or not. And 3. Double check, and then maybe triple check,
that you're using the correct diluent, saline, and saline only. Running through these 3 steps can prevent almost all of the common errors.
Let's just zoom in on that renal function check for a second. If a patient's kidneys aren't clearing the drug like they should, specifically if their creatinine clearance drops below 30, we have to adjust the mission timeline. Instead of giving a dose every 24 hours, we switch to every 48 hours. Why? To prevent a dangerous buildup of the drug in their system.
Look, if you remember absolutely nothing else from all of this, please remember this. Always check renal function and check for statin use before every single daptomycin order. Those 2 simple checks are probably the most important things you can do to keep your patients safe.
So what we've seen is that daptomycin is an incredibly powerful, but also a very delicate tool. It's a specialist that we desperately need to preserve for the fights that we just can't win otherwise. And that really leaves us with a final question for you. How will you, in your practice, make sure this specialist agent is used wisely on your watch?